All right, everyone, good evening. My name is Jennifer Shamloo. I am a registered nurse, but also I am the previous caregiver of my mother, who was also an MSA patient. I'd like to introduce Dr. Shah and nurse practitioner Ann. Um, we are going to be discussing the nursing role and also mindfulness and how that relates to MSA. So this is a question and answer session, and I'll just be reading for you today. So in the chat, there was a question regarding suggestions for MSA patients with fruit and veggie allergies. Ann or Dr. Shah, are either of you able to speak to that?
Say that again, if you can repeat the question again, I'm sorry.
Sure. Suggestions for MSA patients with fruit and veggie allergies. I think this probably relates to nutrition and diet.
Nutrition and diet.
Yeah. The dietary recommendations were about using a plant-based diet for patients with MSA. It's hard to speak to this. It's kind of a general question. So, I mean, if you have allergies to specific fruits or specific vegetables, there may be alternatives that can give you just the same nutrients that you can get from the things, like if you're allergic to bananas, you might be able to get potassium from some other source. So I think that's the kind of thing you should probably speak to your clinician, or if you have a dietitian who's affiliated with your care. That's a good question to ask, because you can't really make a general statement about that, I would say. So.
Yeah, and the best thing is to check with the nutritionist what to replace with. If you have really an allergy with something of some fruits and vegetable, what can you replace?
All right, thank you. And the second question that we have in the chat so far are recommendations for alcohol consumption.
It's generally recommended to avoid alcohol.
Correct.
For many reasons, possible, dehydration. Alcohol does dehydrate you. There are a lot of reasons to avoid it. So it's just a general recommendation, it's just not to have it.
We'll check with the physician. I mean, what level of alcohol they're talking about, glass of wine during holidays, or, amount. So discuss with their clinician.
Sure.
I'm sure no one is going to recommend alcohol for sure.
Right.
But everybody wants to have a glass of wine, right?
Absolutely. So we have Sandra chiming in. Someone earlier stated their physician said a glass or two of alcohol in a day would be okay. And I think going back to Dr. Shah, and it just depends on some of the situational kind of factors, whether that be interactions with medications, how advanced in the disease the person is, and whether that places them at risk for fall or increased risk for fall. There are a lot of different factors that alcohol could play in someone with MSA.
And honestly, a glass or two a day is kind of considered like maximum for a woman. So in fact, if a woman has 2 glasses of alcohol a day, that's considered excessive. So yeah, I'm not sure.
Yeah, there are recommendations.
Question, but and I think probably the most important factor is how far progressed the person is. If someone is just kind of in the early stages, it might not be as much of a problem, but I would generally say most clinicians would not agree with that recommendation, but it's okay.
Right. And again, even if it is early stage, better to stay in a recommended limit. For women and men, there are different limits for the alcohol consumption. So again, and also if they are on a medication, best thing is to talk to the doctor or nurse in the treatment team, what is best for them. But generally, glass of wine during the holidays on a birthday shouldn't be a big concern if it is just a glass of wine during the special occasion.
Thank you both. We do have a question regarding mindfulness. How is mindfulness different from meditation?
Okay, great question. I'm glad that you asked, or whoever has asked. Mindfulness is one type of a meditation. It is a type of meditation. There are different type of meditation. Some traditions has the meditation as a part of their routine things, prayers and things like that. What we do in a mindfulness different is it's more dynamic. It is not in mindfulness, the way mindfulness different from other meditation. I have not done a different type of other meditation that I can speak for, but I can speak for mindfulness. Mindfulness is making you aware of your inner landscape. Mindfulness is not sitting and chanting. You can do the chanting to bring your focus into the bring your attention to a chosen object. Could be mantra, could be breathing, could be sensation. But what we are doing in a mindfulness is we are not suppressing, avoiding, emptying, stopping in our mind. We are observing what is happening in our inner landscape, in our with our thoughts and feelings. So that is in a way it differentiates mindfulness from other type. What they do in other type of meditation and all different type of meditation, I cannot speak for it, but this is what the mindfulness is. But mindfulness is also considered one type of meditation, if that answers the questions.
Thank you. I think so. And I'd like to go ahead and just send out a reminder for those who have joined the chat. If you'd please make sure to put your questions in our chat. That'd be really helpful. Everyone, aside from the panelists and myself, should be on mute and cameras off. So we'll take your questions through the chat, please. I do have another question here. Could you speak to mindfulness as far as how you think it could help slow MSA or help with lessening the symptoms?
Again, it's a great question, and I get this question not only for MSA, wherever I talk for any other condition. Could it really help you lessen the symptoms or progress with your disease? What mindfulness does is help you accept what is there. Whatever is happening in this moment, accepting the way it is, whatever is the reality, that's what the mindfulness is about. When you say lessening the symptoms, to some extent, of course, everybody who are dealing with any kind of diseases are struggling. Why I am suffering with this? Why I have to go through this? What can I do to not have this? So that what we are doing is we are struggling with what is here. When you accept what is here, it makes it easier for you to deal with whatever it is there. It is accepting what the reality is. Acceptance doesn't mean that you say that, okay, it's helpless, I cannot deal with it, or I cannot do this, or you are resigning to that particular condition or particular symptoms or situation. That means that you are starting from the point of what is it, this is the reality, this is what I'm dealing with, and you go from there. And if that, once you accept whatever is there, it makes it easier. And I have experienced that myself, so I can speak that way, that yes, when you accept, what caused the stress is whenever we are struggling with what is there that we don't want is causing stress. And when we are not accepting what is here, we are trying to change the reality. And that is not many times that makes it much more harder. Can you stop the progression? I mean, can you decrease the progression of your disease? Well, if as it comes, if you look at what is happening right now and how can I do the best in this situation from what I have, like people say that, okay, my knee hurt, my back hurt. Okay, go. It is not easy to deal with when there is a lot of pain, when something hurts, something is not function, some part of your body is not functioning well. But what is functioning well, that doesn't define you. What is not functioning well, there are other things too, like you say, you look at the whole picture. That doesn't mean that you dismiss what is happening, but also that there are other things which is right, and you put it in, put everything in a perspective as a whole picture.
Have you seen that mindfulness really helps with depression, anxiety? Is that probably where you see the biggest impact of mindfulness in MSA and related diseases?
Yes, mindfulness helps with, first of all, it helps depression and anxiety. More than that, I would speak from the wellness and resilience standpoint, that it increases your mental flexibility. Mm. And when you're mentally, you are flexible, you are ready, when you are aware that what is here, because many times it's we are not even aware what we are aware. We are not aware and accepting the reality. We are identifying with our thoughts and our feelings more than what actually the experience is. How we look at the experience is by our inner story and our thoughts and feelings. I don't like this, I don't want this. And what does that happen when you say that I don't want this, I don't like this? What happens then? You are not ready to deal with it. Yeah. Or you don't want to accept that. Does that make sense?
Yeah, I mean, so I'm a nurse practitioner, a family nurse practitioner. I'm the my mother has MSA. She's had it for probably officially 6 or 7 years at this point, but she's reached a stage where she really can't do anything for herself. She really can't. She has trouble reading because of her eyesight, and she's in a nursing home, and she pretty much just sits in her chair all day. She's there mostly kind of with her thoughts. She doesn't want to go out of her room. She has trouble speaking to other people, so she doesn't enjoy company. My sister, she lives far away from where I am, but my brother and sister go over there every week, and we have a family call with her. But when I was listening to your talk, it made me think a lot about, skills that it would be good for her to have, to not ruminate, I think, on things that didn't go the way she would have liked in life. And, I think she's considered, if euthanasia were available in the state where she lived, I think she would want that, and just how to deal with all of that. And so when I was listening to your talk, I thought these are the kinds of skills she really needs to have. And it's too bad, she didn't know about that early on. It's something maybe she could have practiced early on, because now she's even showing some signs of confusion. So.
No, and you are so right that that's why I started doing this after so many years of my psychiatry practice. That when you practice this, when you are healthy, when things are going well, you can strengthen your ability, and you can develop this mental flexibility. So when the difficult moment comes, you can untangle yourself from your thoughts and the feelings, and you can choose to respond rather than react. So mindfulness is basically, it does not take away your pain, it does not take away your disease, it does not take away your symptoms, it does not correct your wrong relationship, or your annoying friends, or whoever that you are dealing with. What it changes is your engagement with particular situation and particular people. So that is in a nutshell that how do we see the world? How do we see anything that we experience? Just think that, just take that, answer that question if you can. How do we see anything that you come across in a next moment? I like it, I don't like it, or it's okay, or it's neutral. I like it, I want to hang on that. I don't want it to go away. I don't like it, I want to avoid it. I want it to erase it. I want to change it right away. If it is neutral, we don't care. So most of the time, with the disease, with the symptoms, or any difficult situation, we are reacting. We are the way we experience it by our thoughts and feelings, not actually the experience. What mindfulness teaches is the experience, experiential focus. What is happening in this moment? What is it? If we see the flower, right away we'll say, oh, I like this color. Oh, I like the way it is. It smells. Do we actually, there are a scale for the mindfulness. When I start this program, tomorrow I'm starting the new group, next group, we do the first thing I do is give them a scale. Mindfulness is a 5 aspect: observation, describing, uh, awareness and acceptance, non-judgment, and non-reaction. So I ask everybody to rate yourself into, are you really an observant person, or as soon as we observe, we go with that thing, I like it, I don't like it. Once you say I don't like it, chapter close. We are not open to experience that thing, right? I mean, think about that. And when we are not open to experience that thing, how are we going to change that?
Yeah. I
So
wanted to acknowledge, Marina has, there's a long
Thank
posting
you.
in
I'll,
about
I'll go
it.
ahead and get to that.
yeah,
Yeah.
so
Maria,
sorry, I don't want to take too much time for other question, but if I can just repeat that again, that mindfulness will change your engagement with whatever is happening, rather than changing the situation.
I wanted
thank
to
you.
going to that. I don't know if other people have seen that in the chat about, she's experiencing symptoms. She's 36 and her physician is saying she's too young for MSA. I know in some of the other talks, I know for sure in my talk, there was a presentation of a table that shows the different symptoms and how MSA is diagnosed according to the newest criteria, which just came out this year. And so you can actually look through those and see how many of those criteria you meet. But a lot of clinicians I've seen kind of get seeing things a certain way, and if something doesn't quite fit that, they don't think it's something real. And I've just, for example, my son, when he was small, he had leukemia and he was having liver failure, and I told his oncologist that I thought he was having liver failure, and explained the things that I saw. Well, he was just looking at a very specific, he was looking at the liver enzymes, and they weren't like crazy high. So he said, oh, it's not a problem. And so sometimes I think clinicians fixate on a certain parameter that they're used to looking at. And as long as it's within the bounds of that parameter, they aren't concerned. So, I would say, get a second opinion. I mean, that's usually all the symptoms you described here fit very well with MSA. And, that clinician might have fixated on the rarity of MSA occurring before age 30, but you're after age 30 in the first place. So, I would definitely recommend getting a second opinion about that. So.
Thanks, Anne. And I have a question for you. Can you tell me, what do you find the most meaningful role of the nurse in as it relates to the care of the MSA patient, or in partnership with families that care for MSA patients?
Yeah, so this was kind of the focus of my talk. Really, my talk was focused more specifically to nurses, to try to raise awareness to nurses about MSA, because a lot of times I work in, my main job is as a faculty member, but I do see patients in nursing homes and assisted living facilities. And it's really the nurses and the nursing aides who have the most direct contact with patients, who might recognize some of the symptoms that we're seeing here, and can either, alert the patient or their family or another clinician as to some of the things they're saying, and be that advocate for the patient. I mean, that's the thing I've seen the most in my own experience with my child's illness or with other patients I've seen, is being that person, because this is something that nurses are really trained to do, to be that person who hears the patient, who hears what the family are saying and takes them seriously. I mean, nurses are trained in communicating. So be that person for people to listen and take people seriously and help them navigate the system to get the help that they need. So that's a really important one. Nurse practitioners can go a step further. Maybe you can even be the person who helps to coordinate, because individuals living with MSA with any complex and chronic conditions have to be seen by a care team that involves many different kinds of professionals. So nurse practitioners have a role to play in being that care coordinator maybe. So there are lots of ways that nurses can be involved. But I think the most important thing is to be that patient advocate, because that's something that nurses can do very well. And sometimes people just want to be heard, and that's that goes a long way.
Sure, thank you. I do have another comment in the chat. I'm struggling with the diagnosis according to the new criteria. I do have MSA, but according to my neurologist, who is a researcher, my ASIN isn't aggregating like MSA, more like PD. But in listening to Dr. George speak today, it's too early to differentiate between PD and MSA strictly by our CSF. I'm just not sure which avenue to take now, but not knowing is driving me crazy.
I mean, that sounds like a question that's better for Dr. George or one of the other physicians who were talking this morning. But I know that it is really difficult early on in the early phases of getting a diagnosis, that people do kind of get diagnosed with one things and then maybe the diagnosis gets changed. And it's difficult because even with the new criteria, there's no definitive diagnosis except on autopsy. So there's going to be that some level of uncertainty there until more symptoms arise or whatever the case might be. So, and one of the things that was brought up today, and I'm forgetting which, because I was actually moderating that session, someone asked about a level on a certain measure. And one of the physicians was saying that, you know, a lot of these things just help with the diagnosis. They really don't work well to talk about progression of disease. So those are some things to keep in mind. It is very frustrating, I know, because you want to make sure you're getting the right treatment for whatever it is you have, regardless of what kind of health condition you have. So that level of uncertainty is very frustrating and can be harmful in many ways. But as with the other question, always getting a second opinion if you have that option, if your insurance covers it or whatever the case might be. But
right. Thank you, Anne. I have another question in the chat. Do you have any advice for a caregiver of a patient who refuses to believe their MSA diagnosis? Oh, that's a tough one.
Is that it sounds like you're saying that the patient doesn't believe they have MSA, or that the caregiver doesn't?
That's my understanding. That's my understanding from reading the chat.
The patient doesn't believe. Patient doesn't believe.
Patient doesn't believe.
Dr. Shah, you want to take that? Seems more like a. Are you muted? You're muted, Dr. Shah. Dr. Shah, you're still muted.
Okay, sorry about that. So it's a caregiver who does not believe the diagnosis, or the patient?
The patient doesn't believe the diagnosis.
So I would, first of all, what is patient's thought in that? What do they think that they have? And can they discuss with their physician what the caregiver understood more than the patient? What age group we are talking about here? That patient has a confusion, or they have some other issues about understanding, or cognitive issues. And after that, having the team meeting with the treatment team meeting with the physician, nurse, social worker, if they are involved. and finding it out more that, what is the difficulty patient has about believing or, understanding what doctor is saying and based on the criteria that they are meeting.
Sure. So in particular, in this particular situation, the patient's young and educated, but just doesn't accept it. The patient's in denial.
I would say that, having more and more discussion about that, what they are dealing with, what other, of course, they are in denial. That means, first of all, not ready to accept what they are going through. And discussing that at that moment, that what maybe it's a lot of anxiety, and I would imagine that there is anxiety, is there underlying anxiety of believing the diagnosis? What is the reason of not believing the diagnosis or accepting the diagnosis? And that probably can be done with with the treatment team and having more understanding that what is coming up and what is available for the treatment, that may, if there is anxiety about believing that what they may go through as the disease progress, and having that discussion openly, what are the advances, what are the treatment, and what can be done if this happen or if that happen, that may help patient to accept the diagnosis.
Yeah, and this is something that as clinicians we deal with all the time, right? That you have a patient who comes in and if the person has already been diagnosed with MSA, it sounds like clearly the patient must be having some kind of symptoms. Otherwise they wouldn't have been diagnosed with MSA. And so sometimes there really isn't much you can do. You can't try to convince someone that there's a problem when they're sure there's not. So sometimes it's just about being supportive about the things that they will acknowledge. If they're feeling dizzy or, whatever the case might be, being supportive in the ways that they're willing to accept. Especially since in a condition like this, it's not like the person has an infection and you need to convince them to take antibiotics and the infection will go away. It's going to be a long-term process. So it's counterproductive to try to get into debates with the individual and try to convince them that they're wrong and you're right, let's say. That's not going to be helpful. It's going to make both parties probably frustrated. So sometimes you just have to be supportive in the ways that they're willing to accept your support and willing to accept your assistance.
Right, and it would be helpful to know where is the refusal coming from.
Yeah.
And then you can be definitely more supportive, understanding that where the patient is. And you are very right, and because forcing them to believe what they don't believe is going to be very difficult unless first we know where is this coming from. What are they afraid of? There is a anxiety about progression, disease itself, losing function, or what is going on? What is their mental thought process is?
I do have another question in the chat. Sometimes patients have better rapport with nurses than doctors. Does nursing play a role in the diagnosis, as in the treatment or the selection of medications?
Of course. I know you want to take this question, but I would say this, that working in a team in my psychiatry practice, oh my goodness, and we cannot do it without nurses. And of course, they have a role in that. I would say so.
And this goes back to some of the things I was saying before too. A lot of times, just because of pay differences or other factors, nurses have more time to spend with patients. A lot of times nurses or even medical assistants, depending on how a practice operates, maybe the person who has the time to sit down with someone and talk through what are the treatment options. I mean, maybe the physician or the nurse practitioner makes some recommendations, but it's really a nurse who has the time to sit and talk with the person. And, this is a big difference between the way even nurses and physicians, nurse practitioners and physicians are trained, is that nurses are specifically trained in communication skills. And so we do have that facility, or hopefully to listen with in an empathetic way, that I think that's why a lot of people connect more with their nurse practitioner, physician in some practices, because they feel heard better. Because a lot of times, even with nurse practitioners or physicians, you're paid to be in there for like 15 minutes and then you're out. You're not spending that time. And so that's
Right, the time is the major issue, right? How much time they take with the patient, or how much time they have, the schedule is working that way, and all this, how the clinic is set up. So sometimes there is not much time physician have to spend with the patient, each patient. They go with the symptoms, they go with the treatment, and then rest of is left with the treatment team member, the nurse, social worker, whoever else is involved. And I think MSA, if it is sorry, go ahead.
I have another question for Anne in the chat.
Oh, okay, I see it all. I can.
Yeah. So do you have advice for visiting the ER? In my experience, no one in the ER even knows what MSA is, and it's an impossible situation for an MSA patient. We've avoided the ER whenever possible, but sometimes it's necessary because of falls, etc. Once in the ER, the staff want to put you through the ringer, extensive testing, etc., when we just need some stitches or some simple treatment.
Oh boy. I hate to say this because it really shouldn't be the patient's burden to educate healthcare providers, but sometimes that's what you have to do, unfortunately. And so I would just say maybe to have kind of a pack of material. Some people have like the bracelet that has, if they're diabetic, it kind of informs people like, look, this is what this patient has. You could put together a packet of information that you take with you when you go to the emergency department. So you're kind of more prepared, maybe a little information on what the diagnosis is, and your list of medications, whenever possible. I know when it's a case of going to the ER, you don't necessarily have the time. Maybe you're not home. Maybe there are other reasons why you can't have that with you, but something like that might make those kinds of visits go a little bit better. Particularly if you can get your primary clinician or whoever you're seeing, if it's a neurologist, whoever, to write some kind of note for you that you can put into that packet as well, saying this patient has MSA, and these are the things to avoid, these are the things that don't need to be done, whatever, something like that you could take with you. Just might make it a little bit easier dealing with the staff there.
And I had a very similar experience myself. I only had to take my mother to the hospital twice during the duration of her illness, and one time was for a severe fall, where all she needed were staples, and I had to essentially give the healthcare team an S-bar on what MSA was, what we needed to do, and that we just needed some staples and get out of there. So it was an interesting experience, nevertheless. But I can only imagine when people are not healthcare providers, being able to articulate that in a way where they kind of garner the trust of the team that's caring for them.
Yeah, exactly. I mean, and again, this is a different situation, but my son was having certain experiences, and I was telling people, and they even knew that I was in nursing school at the time, and I wasn't taken seriously. And that I learned from that really is how lucky I am, because I'm an educated person, I am a healthcare professional, I have those resources, and I think of all the patients. There were a lot of kids being seen in the same clinic whose parents didn't speak any English. The interpreter wasn't always readily available. Sometimes they even asked me to interpret for the Spanish speaking patients. So you do, as a caregiver of someone with any kind of health condition, you do get asked to take on a lot of responsibilities and be that your loved one's advocate. And it's very burdensome, but it's necessary if you really want to get the right care for the people that you love.
I think the easiest way to maybe explain it for someone who's non-healthcare is that you have to be your loved one's expert, right?
Mhm.
You know them the best, you live with them, or maybe you don't, but have lived with them. You know their patterns, you know their decline, you know their signs and symptoms. Being able to advocate for them is going to be the very best thing that you can possibly do for them.
Yeah. And even though you are all those things that Jennifer just said, it doesn't mean that people are going to listen to you, unfortunately.
Sure.
And, you just have to be persistent and take care of yourself to be able to take care of your
Exactly.
mother.
Caregiver needs to take care of themselves. That's very, very important.
Yeah, that's the other thing I was thinking when I was watching your talk, Dr. Shah, is about how we could all use a little mindfulness. Whenever you hear yourself making that negative self-talk about, oh, why did I do that, or oh, I don't like this, the way this looks or that looks, or something about yourself, all that negative talk that goes on, um, to just get in the habit of letting it go and not
Yes.
letting it take over.
So I tell them when I do these classes that how many times we use this when we text and all this in chats, LOL, right? LOL. I use that for mindfulness. L means look, notice. O means observe, and L means let go, learn. LOL.
I like that.
Yeah, notice, observe. Notice means you look, what is your thoughts and what your feelings. Observe that. What's your temptation? What are you going to get by acting on that? Stay away from that. Don't identify and watch, observe, let it go and learn. So yes, it is very important for caregiver.
Let's see. Another question that we have: who can teach mindfulness to both patient and caregiver? You talked earlier about how being proactive and doing this earlier on when things are better, and we have more to maybe be thankful for or grateful for, is a really great practice. And so practicing it in your everyday life. But say that we have an MSA patient and a caregiver who have never practiced like intentional mindfulness. How can they go about doing that?
How can they? It's not easy. It's simple but not easy. How can they go about it is just take a few minutes in a day. I start with this. Let's say, can you take a 3 minutes in a day? And during that 3 minute, if you can just sit still, focus on, let's start with the grounding exercise, especially with the patient who may have a lot of the symptoms and certain things that they cannot do. Let's start with just the simple grounding exercise. Sit down wherever you are, feel your feet on the ground. Most of the time, we don't pay attention to that. What do you feel underneath where your feet is touching? Can you can you describe the sensation to yourself? Oh, it is a soft surface, or it's a hard, or whatever it is. And from there on, once you are grounded, see what is going on around you. uh, Listen to the sound. If there is any smell, what do you see? That would bring you in a present moment from your thoughts and your feelings. Because when you are sitting down quietly, many times your thought is either in the past or in the future or planning for the day, right? I mean, many times that happens. So that will bring you in a present moment, what is happening in the present moment experience. Once you are settled down that way, just like if you heard about my meditation, few-minute meditation today in my presentation, then you can focus on your breathing and just stay with your breathing. Every time your mind wander, let's say you have a new symptoms from your disease, any disease or MSA, that your mind is telling, oh my god, what is going to happen now, what if this happened, what if that happened. Just see what is your mind is doing to you. Every time it goes that way, notice that, observe that, acknowledge that, bring your attention back. How hard is that? It is very hard, but it can be done. Did you deliberately do it? every time your mind takes you somewhere, or your mind may take you to the happy moment. Oh, I'm going on a vacation, I'm going to do this. Notice that, but deliberately bring your mind back to your breathing, that okay, I am taking this 3 minute or 5 minute or 10 minute, whatever you are taking, that I'm doing this practice, and right now I have to bring my mind back to chosen object, which could be the breathing, or which could be any sensation, or which could be the sound. And by doing that, you can see that how many times your mind is taking off, and you are identifying with whatever is happening, and before even you realize, you are getting tangled, consumed with this your mind story. So once you keep on doing this, every time your mind wander, you keep on coming back, and see what you are experiencing in this moment, and stay with that experience. And that way you would realize that, when you reflect on this, you would realize that your reaction and your feelings comes, how it comes is when your mind is start telling you some story, and when you start engaging with that, when you start riding with you take a ride with your mind. When you refuse to take a ride, when you refuse to go in that roller coaster, and you stay with that moment, you will see the changing nature of your mind, changing nature of your thoughts and feelings. If you don't, it's like a balloon, it's like that balloon, if you don't hold the string, it will go away, but you want to hold the string. When you realize that, and mindfulness practice will help you understand that, help you realize that, oh, I am holding this string. And every time you bring your mind back, every time you bring your mind wander, and every time you bring your attention back, you will see that for after a moment, it will leave you alone. If you can't let it go, you will be able to let it go, because you are bringing your mind back now, and at that way your mind will, to some extent, I do tell this when I especially work with the young adult, that your mind will get tired of your attention and your awareness, that you are saying that, no, stay there, I'm not coming with you right now. And it is very difficult. As I said, it sounds very simple, but it's not easy. But that way you can train yourself. So this is a self, as you heard in my talk, this is a mental gym. This is a mental workout. And actually, when I am doing this for 10 years, and I still see that it's a push and pull, push and pull. Mind will pull you, you will push yourself back.
Thank you so much. I appreciate that. For those of you that are in the chat, does anyone have another question for the team? We'll wait just a moment to see if anything surfaces. I know there are some excellent opportunities for caregivers and patients tomorrow for breakout sessions as well. So that should be pretty helpful and enlightening overall for the group.
Yeah, we do have a breakout session 1 o'clock Eastern time tomorrow for patients and caregivers. Myself and another person will be co-moderating that. So we hope we'll get a lot of people on at that time.
All right. So I think without further ado, we'll end this session for this evening, and we'll pick back up later.
Okay, very
Thank
good.
you guys so much. I appreciate Anne and all of her knowledge and wisdom, and same with Dr. Shah. Thank you so much.
Thanks for giving the opportunity. Hope it works for everybody. Hope everybody can take few minutes in a day to at least to try it out. If it doesn't work, you are not going to lose anything.
Take care all.
All right, bye-bye.
Thank you. Bye-bye.